Hello again, everyone, and welcome to this edition of Health Center. I'm Lorraine Brooks, and I'll be your host for today's show. I'm very excited about today's show because I have two people as guests on the show who are two of my favorite people, and they're going to be talking about a topic that's of interest to me. And those of you who watch the show regularly know that this is a topic that I often discuss, and that is diabetes. I'm interested in it for a number of reasons. Number one, because I myself have diabetes. And number two, because I work with a lot of people who also have diabetes. And there are a lot of issues that come up when you are struggling with a chronic illness. And we're going to be talking about a couple of those issues today. I'd like to introduce you to my guests on the show. My first guest is Dr. Beverly Adler, who is a clinical psychologist and also a certified diabetes educator. Thank you for coming on the show, Dr. Adler. It's a pleasure to have you.
Thank you for inviting me, and I go as Dr. Bev. I'm very informal.
Affectionately known as Dr. Bev.
Thank you.
So we will refer to you as Dr. Bev.
Please.
And this is also one of my other favorite guests, and you've seen him before on the show as well, Max Zadek, who is the Happy Healthcare host and and Mr. Diabetic. Max,
and I'm
welcome
thrilled
back.
to be here for National Diabetes Awareness Month.
Well, we're going to talk about that in a second. Actually, it's a good thing that you mentioned that because it is National Diabetes Awareness Month. And Dr. Bev was here today to talk about the emotional aspects of emotional issues of people who have diabetes. And one thing I want to ask you, Dr. Bev, because you were talking this afternoon when you were giving your Grand Rounds presentation about something that you called diabetes distress. And you said that that was different from depression. I know a lot of people who suffer with chronic illnesses might feel depressed or sad or hopeless or any of those things, but you said it's not quite the same thing. Depression is not quite the same thing as diabetes distress. Do you want to elaborate on that a little bit or explain the difference between the two?
Yes, I am not going to take credit for the terminology of diabetes distress. That I have to give to Dr. William Polanski, who is a psychologist and certified diabetes educator. He's out on the West Coast. He founded the Behavioral Diabetes Institute in San Diego, and that is a concept that he came up with about diabetes distress. One of the major differences between that and major depressive disorder is that major depressive disorder is a psychiatric condition. Diabetes distress is not. Diabetes distress is as the result of the burdens of taking care of diabetes self-management.
Now, when you say that depression is a psychiatric illness, what do you exactly mean by that?
Well, that has more to do with clinical symptoms, some of which seem familiar and similar to diabetes distress, but they're not caused by the chronic illness. So major depressive disorder can include, sadness and change in sleeping, change in eating, helplessness, hopelessness, all those sorts of, emotions unrelated to the burdens of taking care of diabetes management.
So when you're a person who has diabetes, you can, doesn't necessarily have to be the case, but you can develop symptoms that are similar looking or similar to a major depressive episode.
Correct.
But
correct.
It's not what you're saying.
So what you can have, what happens is three groups appear. A large group with diabetes distress, a smaller group that could just be major depression by themselves, and then an even smaller subgroup of diabetes distress and major depressive disorder.
Now, if you're suffering, because I can relate as a patient as well as somebody that works with people, and I know, Max, you and I have talked about this. The part of what happens is that you either become like micromanaging and you control it, maybe try and control it too much, or you maybe don't control it enough. And there's a balance and a line that you have to walk. And it's not always easy, particularly when it revolves around food and what you're eating and your lifestyle issues.
Among other issues.
Among other issues.
Yes.
Max, I want to talk to you a second about a program that we're doing here next week that's going to discuss it's going to sort of combine what Dr. Bev is talking about and the lifestyle issue involving diabetes.
The biggest lifestyle issue that people think of, always talk about with diabetes, which is food and eating and the food police and why are you eating that? So next week we're going to do the Plate Poetry Project that was developed and created by artist Susan McCaslin.
And what does that involve? What is that exactly?
That's a good
Plate
question.
poetry, because people, it sounds like,
it's going to be shocking. No, it's going to be thrilling, actually. It's a free program,
shock
number one.
and awe.
I think we're going to be asking ourselves, what are our plates saying to us? What do we say when we're eating, and what are some of the conversations going on in our head? And I think, Dr. Bev, what you're talking about is a little bit about the emotional exhaustion of being anxious and stressed out about managing your diabetes. Well, that could also move into the kitchen or the dining room. How do you feel about what you're eating, especially if people are pointing at you, telling you what to have, what not to have, and you're judging yourself around your food? So next week is really an opportunity for people to kind of talk back to their plate and also have a dialogue with the plates and begin a conversation around, what do I really think about when I'm eating? Am I happy? Am I sad? Am I even focused on eating? Most people today are on their phones or at their computers, or they're trying to read something, or they're swatting one kid, or they're doing watching TV. So I feel like this program is really taking that big concept of food, which doesn't just relate to people with diabetes, it's to everyone today, and looks at a little bit more from the emotional impact of it. Because I work in diabetes 24/7 like Dr. Bebin, and this is a topic that everyone wants to talk about. I just find sometimes the conversations are always the same. I was really kind of intrigued by the idea of getting people to look a little bit deeper and not really look at the calories and the fat and the carbohydrates, which are all very important. And they should definitely talk to a registered dietitian about that. And we'll have one here next week, Susan Weiner. But I think it's also important to be kind of looking at what are we thinking around food, and how does that affect our choices? Because obviously, if I'm going to count calories, I'm going to count carbohydrates, and I'm going to count fat, then I have to be motivated and encouraged to want to do it, especially if I have to do it every day. So that conversation to me in some ways has to start first before you kind of get into all those other things. And then you can kind of lead your way into a healthier, happier life. And coping is a big part of that. And you struggle throughout it, you might want to turn to a therapist and really start talking about the emotional side of eating.
And one of the things that I do focus on is being mindful of what you're eating. Mindful if it does have a lot of carbs, being mindful about it. Not that it's bad, not that you shouldn't, not that you can't, but being mindful and incorporating it into your full quota, let's say, for the day.
Well, that's a good point, because I think that's where you talk about the diabetes police and the food police. That's what a lot of people don't understand, that whatever is on your actual plate is your responsibility, and you have the responsibility of factoring that into your allowances for the day.
Exactly.
Is that not true?
Absolutely. And I do think that the diabetes police are extremely intrusive. They think that they're being super helpful and supportive, but they are really not. And it leads to a lot of resentment on the feelings of somebody with diabetes, because it's very unappreciated when people are telling you, should you really be eating that? And I didn't think you could have that. And no matter how kindly they try to phrase it, it's still unappreciated, unsolicited advice. And I think a lot of times the patient with diabetes who is being mindful, they're fully aware of how much insulin or medication that they've taken, so they know what they can have. They know their own insulin carb ratio, or they know how much activity. If they've just run a marathon, they are allowed to have as much pasta as they need, okay? And you can't say to somebody who has a mound of pasta, are you sure you should be eating that? I mean, because you don't know. You don't know what activities they've done, what medications they've taken, and you don't even know the food. Even though it might be a mound of pasta, it could be the special, wheat pasta that's, lower
glycemic index.
Exactly. So,
Well, it seems like they're assuming you're doing a bad job. And when it comes to diabetes, whoever pats anyone on the back or cheers them on, like, that's my big issue with some of the community and what we see in outreach. I feel like diabetes police are assuming you did something wrong. and not something right. And who's turning around and saying, oh my gosh, Dr. Bev, good for you for monitoring your blood sugar before we did the studio taping today. Oh my gosh, Lorraine, that was awesome of you to choose the Diet Pepsi earlier instead of having the Coca-Cola with 65 carb grams. And I'm not making that up. I think those are the numbers kind of basically. I mean, sugar grams.
Right, sugar, right.
And that's a sweet life, right? I mean, that's why you wrote these books, to kind of show people that there are people cheering each other on. If you're dealing with the food police and that is someone you're feeling under attack, sometimes the best thing to do in a month like November is to go to a support meeting or talk to an educator or pick up a resource and hear from how other people deal with it and how they've gotten through it. Because, you know, I mean, there are diabetes police, but there are fashion police and there are food police. I mean, people love to dismiss each other. People love to point out what we're doing wrong. A lot of times we don't love to point out what's going right with someone. And I think one of the coping skills is trying to know where do you fit that all in, and how should you take it in, and how should you work through it. Because, you know, to me, everything I've learned in diabetes is a team effort. I have to support you as much as you support me, and together we're the Charlie's Angels. Or maybe
we are not alone with our diabetes, and that is what all those additional resources and programs like divabite.org and the blogs and the books, they're all extra opportunities not to feel alone. And that is very, very important, because once you're feeling alone and it leaves you to being downhearted. I don't want to say depressed, because that has a special clinical meaning.
Distressed.
Distress.
That's
I'm
right.
learning
That's
exactly
today.
right.
I'm learning
And
with you,
I think
Dr.
the
Bev.
problem with a lot of therapists, okay, so I don't mean to step on toes, you know, doctors, whether they're psychiatrists or psychologists or social workers, they look for pathology. So they are going to find depression because they don't have that concept of diabetes distress. And so they go on the assumption that these symptoms that are very similar of distress, very similar to depression, then it must be depression. And all the literature says, you know, diabetes and depression are linked together. You're 2 times more likely to be depressed if you have diabetes. Well,
is that a misnomer?
I think it's a misnomer. Yes, but diabetes distress, I think it needs more publicity. I don't know what else to say.
I agree with you. It's about education.
I think when people are first diagnosed, I know this came up last night on our podcast, people ask, why me?
Yes.
And that is, you know, because they're wondering, like, why today? Why did it happen to me today? Why did I get diagnosed with diabetes today? This could be for type 1s or type 2s, but I'm sure you hear it on both sides, but
yes.
I would assume we hear it more. I think I've heard
Probably
it more from type 2s.
Mm-hmm.
And, you know, I feel like that's where the distress begins right away. But that would be with anything. If I got in a car accident when I walked out of here, I'd be, why did it happen now? I'd be recounting my steps that took me back to the moment of diagnosis. And I've talked to so many women, Lorraine and Dr. Bev, and men, who remember the exact time and date of when they were diagnosed with their diabetes.
Sure.
Do you?
Yes, absolutely.
Yeah.
And so what does that mean? Like, you know, that we hold that date, you know, that we,
But you know what, if I could just interject for a second. I think it's not quite the same as having a car accident or getting cancer.
I didn't mean it to be quite like
no,
that.
I know, but I'm just saying from a patient's perspective, I think a lot of people tend to, and you can agree or disagree with it, but I think a lot of people tend to blame you. And so the why me, when you say to, you know, your physician just tells you, you know, you have to do this, you have to do that, you have diabetes, you got to lose weight, you know, all the litany of whatever. And so the why me, the answer could be, or the answer you maybe expect partly is, well, you didn't take care of yourself. You ate too much. You didn't exercise enough.
What did I do
What
to
did I do
deserve this?
that brought this on me? And even the literature says type 2 is mostly caused by lifestyle choices. So so for me to say why me, I kind of think the answer to that almost sounds like, well, why you? Because look at you.
Right, which leads to feelings
Which leads
of guilt.
to more guilt and more
Exactly.
Shame and
anxiety.
anger
Exactly.
and fear,
Absolutely.
and if I did this, what can I do worse to myself?
Right,
after
or if
that?
I'm not changing,
There's
then
also
it's-
questions of why is God punishing me? I hear those as well, and I'm like, no. This is not about a punishment from, you know, above. You know, this is something that can be genetic, and you can cope with it. You can manage it. I think that guilt feeling and the anger issues, that's what happens when people don't feel empowered. When they feel hopeless, helpless, looks a lot like depression, but it's really diabetes distress of feeling hopeless and helpless. Once they can feel empowered, they are going to feel stronger, and they're not going to feel that guilt or anger.
So you can take the responsibility and turn it around. That, you know, part of your maybe some
In
choice.
coping.
Exactly.
Responsibility in coping, not
right.
responsibility.
Not in having it.
Correct.
But that's what I mean. Turn it around and make it a positive.
And knowledge
thing
and learning more about it
education, right.
and getting past the overwhelmed feeling of how do I manage this? Now I'm being asked
Which
to
is a lot.
be mindful about eating is very overwhelming alone.
Just that.
And then you have to add monitoring and then your medications or insulin therapies.
It is very burdensome. It really is. I mean, I'll be the first one to admit that.
Does it get easier? Because I mean, people are watching this now wondering like, oh my gosh, is there anything positive I could take away from National Diabetes Awareness Month? You've
Yes.
been living with diabetes for over 30 years. Does it get
38
easier?
years.
Does it get easier?
Does it get easier? I'm going to say this is a strange answer. When I was first diagnosed in 1975, I took 1 shot of insulin a day. That was the protocol of the day. As time went on, I started to take 2 shots. It was long-acting insulin a day, and then they changed the whole protocol, and you had a long-acting peakless insulin, and for meal times you had the short-acting. So I got to the point where I was taking 4 shots of insulin a day. So people would hear that, and they would say, "Oh, I'm so sorry, your diabetes is getting worse." And I would say, no, not at all. My management is getting so much better because now I'm more closely approaching what the pancreas does. And so does it get easier? I'm going to say I don't spend that much time really focusing on it. I do what I have to. It's very quick. It doesn't take long to check my blood sugar. It doesn't take long to take my insulin, and it's done until the next time I need it.
But see, you just said something really interesting because
Thank you.
not that
She is very
not that
interesting,
you don't
Lorraine.
usually say things that are very interesting, but one thing I just want to pick up on, that you know, the thing about the responsibility of it and the making the choices and everything. I mean, I think for me, you know, whatever I do, and I want you to talk a little bit about the plates too, because it's gonna, you know, it all comes together. Whatever I do has some potential for what's the word, for attracting attention, whether I'm eating the piece of cake or not eating the piece of cake. It's
Yes.
kind of the same thing.
Yes, absolutely.
It's kind of, well, why are you eating the piece of cake if you're eating it? And you and I have talked about this. I had a birthday party when I turned a certain age a
Yes.
few years ago, and I did not have a slice of my own birthday cake. I did not. Not because I just didn't want. I didn't want it. It was, I had already eaten other stuff, and I didn't want to have the cake too. So, am I eating the cake, or am I not eating the cake? Brings about the same type of comments sometimes. Why are you eating it? Why are you
I
not
would love to
eating
know
it?
what your poetry is. You're going to have to come next week and
I
see
have
what
to
you
write a
write,
poem
what
about
you put
this.
it down on plates.
I
What you-
know.
That's what people could do, Lorraine. They could walk up to a table before, after, during lunch and create their own statement around what
Yeah.
they're thinking right now.
Yeah.
So if you were standing at a vending machine and someone walked by and said, don't get anything, you could come right to the plates and spell it out. I think that's helping deal with the anger. That could be helping dealing with the stress. And that could just be begin shifting maybe some of the tidal wave of those things that people are sending each other, bombarding them around these ideas. And I feel with people with diabetes, they're very exposed as far as food is concerned and what you're choosing. Most of us eat without thinking. We're just
No one
grab
makes
it on the way to
comments
go.
on anybody else's
so,
plate.
Right,
you know, to
exactly,
have
exactly.
someone talking to me about my food, if I'm not even talking to myself about it, would be really overwhelming and
It's
also
kind of
very
intrusive,
distracting.
yeah.
It's
Yeah.
very
It's
intrusive, and it's
intrusive, yeah.
really borders on rudeness, but
Yeah.
they do it on both sides. So why aren't you having a piece of cake? And they'll say, come on.
Right, it's your
come
birthday,
on. It's,
right.
you know,
Well, that's the other
not
thing.
going to hurt you. So they're very unhelpful, okay? And then you get the other end of you know, Are you sure you should be eating that cake? Even if it is your birthday, you get both ends. It's a lose-lose proposition. People either push you to eat food or people tell you not to eat the food. And you can't win. You have to make up your own mind. You have to be empowered to say, no, thank you, I don't want the cake, or yes, please, I would like the cake, because I know how much I've allotted in carbohydrates in my meal plan.
So it's a balance for the whole day. It's not just this one meal or whatever's on your plate at
And
5
it's a
o'clock.
matter of
It's that
being
question
assertive. And
Okay.
that is the hard part. That is
Well, that's
the hard
assertive
part.
across the board, and being an advocate for your health would make you assertive to talk back to someone about
Ask
that.
the questions,
So
yeah.
what you're saying earlier about knowledge and having, is it easier? It's easier when you really kind of face it, claim it, and kind of move through it, and then it makes all these little things, these disruptions in life, a little bit more manageable for someone who's watching today, I think. Correct?
Yes, I do
And Lorraine,
agree.
it's got to have been a little bit easy. Is it easier for you today than it was when you were first diagnosed?
I don't know how to answer that question. I would say yes and no. In some ways it probably is. In some ways it probably isn't. And the longer you have it, and Dr. Bev can attest to this, the longer, because I've had it for over 30 years as well, and I think the longer you have it, in some ways it becomes, as you get older, just as you get older, it becomes, your energy level is not what it used to be. For me, my energy level is not what it used to be. My focus is not what it used to be. My attentiveness is not what it used to be, just because of age. And so I would say on some level, I have to pay more attention. I think in other ways, I have become empowered over the years, or more assertive, to understand that I have to ask my doctor more questions if I don't understand something, or I don't agree with something, or I think he's wrong. And I can now tell him that. I wouldn't have done that 30 years ago. Whatever my doctor told me to do, I was going to do it without questioning. Now I'll say, well, wait a minute, I don't think that fits into my lifestyle, or I can't take that pill 3 times a day because I'm busy during the day and I'm likely to forget it 5 out of 6 times, I think it's a balance, like Dr. Bev always says.
No, it
It's
is
a
a
balance.
harmony,
As you reach time, as you move through the phases of life, I think you have to adjust to whatever phase you're going through and work your diabetes in to whatever phase you are at that time.
And also, but I have to say, maybe the bigger message is that both of you have both legs. You both aren't
Yeah,
blind.
right.
No one has problems
right.
with their kidneys that I know of.
Correct.
You both haven't had strokes,
Right.
and you're both claiming to have been living with
Right.
diabetes for over 30 years. So someone
Right.
watching, and I think you're being honest about, maybe the choice of words and easy wasn't right, but the message clearly is 30 years after being diagnosed with diabetes, look what you both have. And I think a lot of people watching think of everyone always suffering a very significant health complication. And it
Sure.
doesn't have to be so, that they could find the help, support they need, the coping skills to get through that. A little food police once in a while is a lot better than a complication, right?
Well, yes, it is. And you have to, and I think what we're doing now is really important, which is talking about it. I mean, just kind of outing ourselves, in a way, and the other thing is, and I think you know this too, Dr. Bev, the question of whether you should out yourself, whether you should tell your coworkers, whether you should tell your friends, whether you should tell your first date, how would you advise someone?
Situation specific.
Okay.
That is really my answer, because not everybody is safe to tell. I don't want the diabetes police on me, and but I also don't want to leave myself open for having a health problem. One of the things I do recommend, it's the easiest thing, is to have a medical ID. So even if I don't out myself, I actually, if I would get into trouble, mine is very nicely hidden as a piece of jewelry, but it's there if
I like that.
if I would
You're
need
very
it.
deep about
Yes,
it.
that's quite diva-ish.
But I am going to say the one thing I think that has changed probably the most over all these years is attitude. Okay, and I think that's really
on behalf of the
on behalf of myself, for one. Okay, and because as I maintain my success, I have a very positive attitude about my diabetes, and I can help teach other people to have a much more positive attitude. And having a positive outlook leads to a positive outcome.
Well, I'm glad you said that, and we have to wrap it up, but I just want to piggyback on your positivity.
Yes.
Because you have written 2 books. I don't know which camera we're using right now, but you have written 2 books. One is called My Sweet Life, Successful Men with Diabetes, and the other is My Sweet Life, Successful Women with Diabetes. And I'm proud to say that I actually wrote a chapter in the women's
wonderful
book.
chapter.
Thank you.
A very inspiring chapter.
Successful Women with Diabetes, and about positivity, because one of the things that you were trying to bring across in both of these books is that it doesn't have to be a death sentence. It actually could be a blessing in disguise.
Absolutely, and all of the authors in both of the books all subscribe to, it wasn't easy being diagnosed, and some of them had more or less adjustment issues, but all of them ultimately got to the point where diabetes was not the enemy, and they were able to embrace their diabetes, it's part of them, and feel good about themselves and feel good about their care.
Well, thank you very much, Dr. Bev. Thank you very much, Max. And I hope that the message we're sending to everyone out there who has diabetes or knows anyone with diabetes is it is not a death sentence. You can live with it. You just need to cope and have a team. Have a team, and hopefully your team will include good people like Dr. Bev and Max. Thank you for tuning in, and I hope you watch us again on our next episode.